Good morning, and welcome to our second session of Technology Association of Oregon's Health Tech Summit, focused on the advantages and disadvantages of expanding mental health treatment and research in technology. This goes anything like our morning session did. People will be joining strategically right after I've done my little welcoming remarks and the interesting people take over. I'm Skip Newberry, President and CEO of TAO, and I'm joined by Riley O'Brien, VP of Events and Experiences at TAO, who's providing back-end Zoom support. A couple of logistical items before we start. All participants have been muted. Please remain on mute unless a TAO staff member unmutes you and calls on you to talk. You may ask or respond to questions in the chat box publicly or privately by directing your message to me or Riley, who is under the name TAO Events Team. We'll monitor the chat box and respond throughout the discussion. We'll also ask you all to engage via the participant icon on your screen. We also want you to engage with us on social media, both during this presentation and discussion, as well as throughout the day. We love to share what's going on at TAO and get participant takeaways from our events. We also want you to join today at noon for our innovation showcase, which will feature up-and-coming health tech companies from Oregon, as well as Israel. A huge thank you to Otradi OBI and the Israel Consulate General, to the Pacific Northwest for underwriting our 2 days of programming for the Health Tech Summit. We appreciate their support and are excited to explore topics related to digital health. Finally, it's my pleasure to introduce our moderator for this conversation, Chief of Staff, Head of Strategy for Litics, Reggie Weidman. Reggie?
Thank you, Skip. We don't have any slides, so it's just going to be us talking for the remainder of the time today, but I think it's going to be a really good conversation. As Skip said, I'm the Chief of Staff at Litics, and I was thinking about a conversation I had recently between the difference between being a practitioner and an enthusiast. I am an enthusiast for mental health who has the pleasure of having a conversation with some very talented practitioners today. So I would like to give them each 30 seconds to tell you a little bit about themselves before we jump into our session. So let's start with you, Saurabh Kothari with MindCurrent.
Oh, thanks, Reggie. Hi, everybody. I think you'll learn a lot more about what we're doing at MindCurrent throughout the course of this conversation. But the important thing to note here is that we are really looking to close the gap. What we do with our customers is we close the gap for the 92% or so of your staff that doesn't get therapy or mental health support in any other way. We are supporting everybody on your staff through Slack and Microsoft Teams directly. We're an appless platform. So I hope that helps. I know my colleagues will fill that gap very quickly. So.
And Dr. Joan Fleischmann of Tend Health.
Hi, good morning, everybody. I'm Joan Fleischmann, and I'm a clinical psychologist and co-founder of Tend Health. And Tend Health brings specialized, accessible, and very highly personalized mental health services to healthcare professionals. So we are a technology-enabled company, and I'll talk a little bit more about that.
Awesome. And Dr. David Sheridan with OHSU.
Hi, it's nice to meet everybody. I am a pediatric emergency medicine physician up here at OHSU. And so obviously I take care of patients in the emergency department, and then stemming from just the exponential increases that we see in suicidal patients in our emergency department, we have ongoing clinical trials trying to basically utilize wearable technology to create kind of more of an early intervention platform for patients in the outpatient setting to hopefully keep them out of crises and needing to come to the ED.
Thank you. And so as we jump to our first question, I want to share a couple of baseline assumptions that we've kind of agreed to for the context of the conversation we're going to have today. So the first is that we aren't really living in a country that provides ready access to mental health support to all of those who are in need. We also, while hopeful signs persist, are still reckoning with how to have conversations about individual and collective mental health. And it's also becoming increasingly clear that not only caring for one's mental health caring for one's mental health takes on your ability to perform in both your professional and personal lives. I really butchered that. And so with those assumptions in place, let's jump into our first question. And I'm going to start with you, Joan. Our audience is the tech industry. How and why is it imperative that companies begin to provide proactive mental health support to their employees? And further, what does proactive mental health support look like?
So this is something that we work with all of our organizational clients around, is getting people connected earlier than later. And really, once we really identifying a crisis, it's kind of too late. Although we work with a lot of people when they kind of hit that point where they really need services today. And that's one of the things that we do, is really offer that access to mental health services. So I think this is a conversation we should all be having around how do you provide proactive service to your staff, and looking at, does that mean you provide a self-assessment where then you say, hey, these are the kinds of things that you're experiencing. It might be of your interest to look at this menu of options. Here's all the different things you could do. So it is important that we are starting to, just like if you have a pain in your leg, are you going to wait until you can't walk before you go to the doctor, which is, I think, actually what a lot of people do? Or are you going to incentivize people, say, hey, you have a pain in your leg, maybe you should take a couple hours off of work and get that checked out before you can't walk, and then you can't do your job, or you're going to need some additional time off. So if you really think about it from that lens of how can we support people to get that help early, by actually incentivizing or encouraging them to do that at the first signs that something's a little off.
Interesting. Thank you. And David, I noted in your bio that you've done some work on sort of preventative pediatric mental health care. So I would think you would have a pretty unique perspective here as well.
Yeah, in terms of workplaces and stuff, I'm very focused on adolescents, so a lot of them don't have jobs. But otherwise, I think what you're saying is kind of exactly. I'm on the back end of mental health, meaning that patients get into crises and then have nowhere to go, so people come to the ER. And so, as an ER doctor, I did not think I'd be doing research in mental health, but it was just kind of a massively growing area that we really don't have a lot of great answers to. So, in case you guys don't know, when people come to the ER, basically we can do kind of safety assessments and medical clearance and stuff, but then it's not uncommon for patients to sit in the ER for days upon days. So last month we had a patient, an adolescent in our ER for about 12 days waiting for an inpatient bed. And so a lot of where my research kind of stemmed from was trying to use problem-based innovation to say, hey, here's our problem, how can we start to address this? And so what kind of came out after a lot of work was, maybe we can utilize wearable technology to kind of create new physiologic and biometric data that the patients could use on a smartwatch or something like that, and be monitoring their symptoms at home. And when they start to realize things are getting off, they can kind of start using their coping mechanisms and things that they've developed with smarter people than I, namely their psychiatrists, their psychologists, their therapists, to hopefully keep them out of crises. Because currently we wait for people to get into crisis, and then we rely on them to go tell somebody they're in a crisis, and then we rely on them somehow to get help. So it just seems like it's the one part of medicine that I take care of that does not aim at preventative treatment or have good monitoring options. Kind of like Joan's point about the person with a sprained ankle or something like that. We don't wait for diabetics to get into diabetic ketoacidosis and come to the ED critically ill. They check their sugars like 5 times a day. They try to keep an eye on things. So a lot of our research is pretty early on, but it's trying to find more objective ways to kind of empower patients to monitor their symptoms at home, and then creating a system around them so they can have the support to get the care they need.
Interesting. Thank you. And Saurabh, what's your take?
So I think if we can organize this visually for people, I think you can think about a stack of mental health care where what we do at MindCurrent is driving the awareness, and we're actually generally the first touch for most employees of what the entire spectrum of mental health actually looks like. They're shocked that there are things they could do that have nothing to do with a therapist, that have nothing to do with mindfulness, that have nothing to do with meditation. In foundational things like sleep, we're just starting to schedule your day. So I think we're at the top of that stack of sort of a large number of people understanding what mental health is, making their awareness up. Joan's in that active state where you can really have a huge impact on a person and help them with trauma and many other things they're dealing with. And I think David's actually in the reactive state, that the person has missed the golden opportunity or window. And David is at this point, like, not to over dramatize it, but making sure that we are saving lives, right? And then we're
right, yeah,
into the active window where Joan and other professionals can help them. And so I think it's important, Reggie, to have that framework. And it's very unique to have the three of us actually in this conversation. I just want to point out that if my co-founder were sitting here, you'd have another psychologist. Dr. Drew Brazier is a performance and behavioral psychologist. And that's why we're sort of at the tip of the iceberg, is for some people at our clients, they will absolutely, we will start to talk to them about like, hey, do you have a therapist? Because if not, let's start you down that discovery path. But again, for most employees, that's not something they're currently considering.
It's interesting. So you guys lead me to sort of an ad hoc follow-up question. So it wasn't on the list that you were given to prepare for, but how important is modeling? And I'll elaborate to say that, particularly as the chief of staff of my organization, I found that it's critically important for me to sort of talk about, not explicitly, but like my mental health and things that I do to sort of like care for myself and taking time off, because I recognize that in the position I'm in, there are others who are going to sort of follow that path. So I'm interested in your perspectives on, in an organization, the importance of modeling, and to give David, you a version of the question to answer. Do you see anything there related to sort of the parent caretaker child relationship? And I'll throw into that like formative experience for me was my mom sending me to therapy as a child and learning to not feel ashamed of needing to talk about my feelings. So since I kind of targeted you, David, let's start with you and then we'll go to Saurabh and John.
Sure. Yeah, I think it's kind of complicated, like especially with parents and stuff. Like we see a huge number of parents that bring their kid in because they had zero idea their kid was kind of to the point that they were at, so it kind of gets back to like trying to create a system around the patient so that they can kind of have the support that they need, rather than the kid getting to the point that they just took a whole bottle of Benadryl and then tell their parents and they come to the ER. So kind of that modeling thing, I think there's a huge gap of like parents don't even get the opportunity to model because they don't even know what's going on with their kid, just the way that we have stuff set up now. But I think modeling is huge. I think the other thing that I see in the ER is, you're right, people think that therapy is like you go sit on a couch and talk up to the ceiling and look at pictures of ink blots or something. But then, when you kind of like talk through like, oh, what people do, or like there's a lot of people in therapy, and giving them examples of kind of what they don't expect of like people who are in therapy, I think that's huge, and it gets people to really kind of buy in and understand that it's not like a specific really weird subset of people that need mental health care or therapy. It's the vast majority of the population. People just do it in different ways in different settings.
Yeah, interesting. Thank you. Saurabh, what do you think?
I was actually going to ask if Joan could go next. I think it would actually make more sense, Reggie, if that's okay.
Sure. Well, I was just thinking about the reduction of stigma around mental health and reduction of stigma about not being okay. We need to make it okay to not be okay all the time. And I think, why do people not, I was thinking, why do kids not talk to their parents? They haven't maybe created a place where that's safe to talk about their problems or what's going on in their lives or their internal experience. And there's a lot of shame, and that starts very early. And I think there's a lot of shame for adults around their internal experience. And so I think, yes, there's a place for modeling and talking openly about whether it is something like suicidal ideation or depression or anxiety, grief, trauma, being able to be open about that. And also being able to say, yeah, I go to therapy, or I go to this group, or this is what I've had to do with my sleep, or this is what I've had to do with my eating to make life a little bit more sustainable for me. And so I think it goes back to reduction of stigma and reduction of the shame and guilt that people experience.
Saurabh?
Thank you, Joan. I just wanted to bring two things I think that we didn't cover here, Reggie, when it comes to modeling. First of all, unfortunately, most managers and senior management, in our experience, are very ill prepared for conversations around mental health. The pandemic hit them really, really awkwardly, where they weren't prepared to have these conversations or how to support their teams. The other thing that's just as unfortunate is the pandemic has actually been much harder for frontline workers in many, many ways. And I think we'll talk about wellness in a minute. But it has been, frankly, less difficult for those that are in management and leadership positions. This is statistic. I'm not speaking from a bias. So modeling has become even more difficult, because I think the one thing you want to be very careful of when you're leading a tech org is don't mandate mental health. Don't try to tell people how to take care of their emotional and mental state. The best thing you can do is what I'm going to do here. Demonstrate. And the reason I did that, Reggie, is because half the people that are now watching are going to drink something. I just reminded them that they're thirsty, which is intentional because we're all underhydrated. So that, I think, is the main difference. And I think leading organizations are now starting to see this, where leaders and managers are demonstrating healthy mental health practices instead of mandating to staff. We've given you benefits. Why aren't you using them? I don't know how to use them.
Yeah. You know, Saurabh, I did take a drink before you did. Let's clean that up.
Exactly. You modeled it to me, and I modeled it to everyone. Here we go.
But let's turn to that topic of wellness. So it's an interesting topic, and it's sort of a new buzzword that we all learned, I would argue, during the pandemic. So what is wellness? And specifically, how can an organization consider wellness as a success metric? Like, what does it look like? How is it individualized? David, really interested in your perspective, again, like coming from the ER, like how do you measure a human being's wellness? Like, and what does that mean?
It's a good question. We don't think much in the ER about that. I think it is important. I think we talk about it a lot in the ER, and we talk about it more for staff. Kind of back to your other point of just healthcare workers during the pandemic. There's been a lot of focus on wellness and the stress and stuff with COVID. I think it's basically just kind of helping people realize that it's okay to take time for yourself, and putting other things in front of work. Like, I mean, the key though is you gotta keep working. You can't just kind of give up on work because you want to go focus on wellness or something like that. So it's finding a balance is kind of what I talk about. I always try to focus on like work-life balance. So it's not that work's just going to get easier. It's just making sure that you're taking time for yourself if you're dealing with specific stressful stuff. And so trying to measure that, and it gets back to Jones's point that I think it's okay to not be okay sometimes. Like, I think sometimes people feel like when they don't feel like they're okay, they're in a crisis, and then like it's totally abnormal, but it's okay to be stressed out, a little bit anxious. You just got to figure out how you deal with that. And I think that's where wellness comes in. Is I get anxious and stressed out sometimes working in the ER, but I have approaches and ways that I deal with that without kind of going off the deep end,
Interesting. And Joan, what's your take?
Well, when we were kind of preparing for this, I talked a little bit about how we have shifted away from the word and language wellness to use the word and language well-being. And really, we're focusing on kind of well-being. And if you take that word apart, it's well-being. And I think a big part of this is about thinking about wellness or well-being not as a problem to solve, particularly kind of on an organizational level. Well-being really needs to be a value that needs to be upheld. And the question to ask, leadership, I think, is this: what does that mean to uphold this value of well-being? What does that mean in terms of your organizational structure, your policies, your practices? Can anyone at the beginning of a meeting say, hey, I need a bio break, or I need to run downstairs and grab a snack. I didn't realize how hungry I was. Or, my water bottle is empty. Anyone else? Can we just take 2 seconds and go fill our cups? And so making that part of the culture. So we really talk with organizations about how do you bring well-being as a value to your company versus this thing that we need to solve. And then how do you measure a value? So if it's going to become a metric, like how do you measure your value, your other real tenets of your organization? So that's what I would say about that.
Interesting. Well, that seems like a great segue to you, Saurabh.
Yeah, I was actually just going to pick up right there, Joan. So we start with measurement, right? We're a data science platform, and our recommendations are delivered by Slack and Teams every single day, right, to every employee. So from our perspective, we never talk about wellness at all. We talk about performance. And the reason for that is we don't fundamentally believe long-term companies are interested in wellness from a purely capitalistic perspective. We think the thing they're very interested in is performance. So from our perspective, we break that down, and I think we're going to share a link here. We're going to share some of this data on Friday. We're doing a follow-up for folks here. But we look at how well employees can focus, how motivated they are, and what teamwork is like, right? Because you can't be focused, right, and motivated or collaborative if you don't have a minimal amount of physical, mental, and social health. So you see, we just don't even use the term wellness. And what that's mean for us is we have completely jumped above, an advocate in the company for wellness, straight to the head of HR, straight to the COO or CEO. Because what we're talking about is your top performers are going to leave unless certain cultural changes are made or unless certain goals are redefined in your organization. And that completely shifts the conversation away from a benefit, which is something that's optional. Performance isn't optional. You have to perform as a company. So that's how we actually look at what is, I think, so far been called wellness.
Interesting. So follow-up question, I think specifically for you, Saurabh. So related to that, I am an organization, right? And you are providing a digital tool. Like, what do I do with the data, right? If my responsibility is to ensure the wellness or the well-being of my organization, like, what is my responsibility to do with that data to ensure that goal?
Okay, I see what you're saying, Reggie. So I think that would be a huge, huge user interface issue, to put some tech terms out there, if we were to dump data on you, because last I checked, you're not a performance or behavioral psychologist or an IO or organizational psychologist. So I really think that's a misnomer. If you're getting data from your provider, you should just stop them and be like, yeah, I don't have time for this. What does this mean? So that's actually what we do. The recommendations that are provided to each employee, we summarize that. And the difference, I guess, with mine current and newer providers is you don't just provide the dashboard or recommendations to leadership, because that destroys privacy. You provide it to everybody. Everybody in the organization, every team member can see where the culture or the performance is at and what's needed. What are the gaps that we have to fill? Then you actually start to make organizational change because you're calling it out. And if you don't want to do that, then you don't use Minecraft, right? Then you find like some tiny little solution and say, hey, employees, go get that. So I would say that we would put our customers at a huge disadvantage if we were providing data, and it would be a complete breach of privacy. You get horrible data if we only provided that data to leadership.
That's interesting. That's an interesting perspective. All right. I'm going to give you guys a broader question, and you can paint whatever canvas you like with it. And let's start with you, David. So our next question is, how can we use digital tools to create scale in providing individualized wellness, well-being, or mental health care, whatever angle on that you want to take? And what are the limitations of digital tools? And specifically, what are the costs and benefits? So how do we use the tools, whatever tools we're using, to create scale for the people we're trying to serve? Because we're all individuals and we're trying to provide a broader service to a large swath of the population.
I think it kind of affords you the ability to scale in the fact that, like I said, there was a patient in our ED for 12 days, right? That's just because there's limited resources. So not everybody can get in with an outpatient provider in a really fast amount of time. And there's just mental health is a tough system for a lot of our patients to traverse and figure out. So I think technology allows, if you can individualize it and figure out kind of what is effective technology, it allows people to use it on a very large scale. And the fact, like I'm talking about wearable technology, right? So that would mean that a person could be wearing a Fitbit, an Apple Watch, a Garmin watch, and be kind of monitoring their, from our standpoint, we look at suicidality, their suicidality stress measures and things, without all of their friends knowing that they have that going on or that they have a suicide watch or something like that. So it allows them to kind of go about their normal life outside of the hospital or outside of being like a medicalized patient, and monitor themselves in a really large kind of longitudinal way as they go about kind of growing up, It's the same with adults. I mean, they could do it in their normal life as well. I think the limitations of technology, though, is that there's a lot of technology out there that measures stress and measures all these random things that I'm not really sure what it's telling people about, to be honest with you. When I talk to like the smartwatch manufacturers and stuff, they tell you that what they're measuring is very generic and summarized data and stuff. So like our clinical trials are trying to be very specific in what we're trying to measure in the outcomes. Whereas what I worry about sometimes is if you look at how many mobile apps there are and all kinds of things out there, I don't really know what they're telling patients, you know what I mean? And so I think if you're going to use technology, it has to be developed in a very thoughtful manner to have specific outcomes, specific populations that you're going to use it in, so that it's useful. It kind of goes back to like Saraz, if you're just getting data, what are you going to do with it, right? We all get way too much data, I think, currently from all of our wearable technology, our devices and things like that. So instead of just getting junk data, we kind of have to have actionable things that come from the technology. So I would say that's the biggest limitation that I think people need to think about as they're developing technology and trying to implement it for more like mental health and medical care.
So that's a really interesting perspective. So do you see some danger with the wearable technologies that I can say as an individual acquire on my own, that it becomes like the new Google for my general practitioner, that like I get a rash and I Google purple rash and go, oh, okay, here's what I do, instead of actually talking to my doctor?
Yeah, oh, big time. So I can tell you as an ER doc, we see all kinds of patients that come into the ER because their wearable technology or their home pulse oximeter device told them for 2 seconds that their oximeter number was 88%, where it doesn't matter at all. Clinically, it means nothing. And so they just wasted a lot of money and time to come to the ER, to be honest. So that's why I think the problem is that if you develop this technology and you just kind of release it on a large scale, people have no idea what to do with it, right? I mean, I went to 4 years of medical school, 3 years of residency, 3 years of fellowship to figure out what to do with data in some respects. And so I think that's the biggest problem. And we see that all the time, that somebody's smartwatch or device doesn't tell them something, but it looks abnormal. So they come rushing to the ER or the provider. So that's why I think if you're going to scale it, you have to have it targeted to interact somehow with a healthcare provider, a mental health therapist, or something like that. They can kind of interpret it a little bit more for lay people.
Yeah. You went to medical school and I went to the Apple store.
Yeah, there you go. Right. Yeah. Both are great educations,
So Rob, what's your perspective?
Well, I mean, this is our bread and butter, right? Is actually scaling, the sort of applicable, immediately actionable insights that you would get in a 2-minute conversation with Joan or with any of her, practitioners. That's what we're doing every day, right? In mass via Slack and Teams. So that's exactly, I mean, it's the polar opposite of what David's talking about, because, a very simple example. We recently did an exit interview for somebody who was burnt out, executive leaving one of our clients. So it didn't work. Whatever we tried, whatever the client tried, it didn't work. She needed to leave, right? It was the first time that she mentioned to us, because we talked about her sleep. And it was the first time she mentioned, like, yeah, I got a Fitbit 6 months ago. And it keeps telling me that, when I go to bed at 1 or 2, I don't get enough deep sleep. We're like, yeah, you're not going to get any after midnight. She's like, really? I'm like, the Fitbit didn't tell you that? She's like, no, it just told me I'm not getting it. I'm like, well, what's the point of that? Right? So I think it's a matter of immaturity. If you just think about the market and technology, right, the products that don't serve the purpose, they will just basically be voted out. Unfortunately, David, we're in that spot right now where there's too much tech, right, and too little care. Mm-hmm. If you have the right care, the technology is phenomenal. When you don't have the right care, right, the technology is disruptive.
Interesting take. Joan, what are your thoughts?
Well, I think that's a great example of kind of what I was thinking about with this question, which is, I think technology has been really, really good at getting info out there and providing information, but not great at tailoring it. I think that's what you're saying, and not great about, I think the expertise that a seasoned clinician might bring to a conversation with that executive would be the right info at the right dose at the right time, delivered in the right way. Because we're humans, we're social creatures, we can read body language, we can read tone of voice. So much of our communication is done through nonverbal communication, and we can start to understand kind of how this person is navigating the world, their worldview, how they make decisions, how they prioritize, what's going on that this person is going to bed at 2 a.m. Is that her natural rhythm? Is that her natural cycle? Or is that because of something going on in her personal life, professional life? But this idea of kind of the tech is not super effective with connection, creating that connection. And I think some technology has figured out a way for people to feel more connected to the technology But if you guys remember, I'm totally dating myself, but do you remember those like little digipets? They were like this big, they came on a keychain. Yeah, okay, we're all maybe from the same generation. So there's this, there's one thing of like caring for this digipet and feeding it and taking it out to go to the bathroom. That is no replacement for petting a dog or a cat, looking a dog or cat in the eye, being with a dog or cat on your lap. So I think that's just a great example of what you lose and what you gain from a human connection. And I would just say, we know the effective ingredients of therapy. So when you're at the point where you're providing a clinical service through to someone who maybe needs that next step, that we know that effective ingredients of therapy is, one of them is the relationship with this other person. And so how do you create that with tech? I'm not sure we've figured that out, or if that is truly possible. Although I'm sure people are like, I'm sure you could, there's probably research going on with like avatars as therapists and AI, and kind of this idea of it not being a human at all, but like a human-like figure, and reading the body language. I'm sure that's being researched, but there's something about sitting with another human, looking each other in the eyes, and having that resonance, that is what is lost in tech, I think.
That therapy avatar example terrifies me when you know that, Joan. So a follow-up question to this, because I want to dig in a little deeper. So I feel like I'm hearing that, I began this conversation discussing the enthusiast versus the practitioner, right? You are all practitioners. I'm an enthusiast, so I can maybe use tools to augment my ability to take care of myself, but that lack of expertise clearly at some point becomes a problem. How do we balance that? Like, how do we balance digital tools that are giving people a greater awareness or access that they didn't have before with the potential lack of expertise as they scale? And that's to anybody who wants to take that on.
I actually wanted to start that because I think that we actually have found a sweet spot with that specifically, Reggie, and I want to talk about 2 layers of scaling with technology. Because most people that aren't practitioners don't know about the tremendous amount of scaling that's happened with technology for practitioners, right? In the beginning of the pandemic, the first 6 months, the scaling was all about creating access. Very quickly, we realized we don't have the experts, and we need to find and recruit and mobilize more experts. So I actually think that technology offers 2 things that are really, really powerful, and we have data to prove this, right? Not over the pandemic, but not just for the pandemic, but even from before. One is the ability to provide personalized insights to an individual on an incredible frequency, like providing it every day on a personalized level and letting them know that, hey, you had a skip day today. That's totally fine. We'll pick this up tomorrow. No worries. Don't judge yourself. That is incredibly powerful when it comes to mental health, right? And how long did that take? 10 seconds, right? But it has to be personalized. The second piece, or the magic to that, is finding a model where practitioners like Joan and others can actually provide insights and personalized care in those small, sort of nuggets. So there's 2 layers to technology scaling that can be extremely powerful. I think when you don't have both of those is exactly when we have a problem. When we're thinking that something that worked for me will, for some reason, work for other people in my organization, why? Why are you even thinking that way?
Mm-hmm. Interesting. So I have a follow-up question because, wait, somebody have something?
Oh, I was just gonna say, I think it's having them in conjunction with each other, right? I think potentially what happens now is people just have technology, they don't know what to do with it. I think technology has some amazing power, and so we're at a totally different place from a medical standpoint with these home monitors and wearable technology. The key though is you have to have like a provider or a person. Again, it's like a dog and a digipet, right? 2 totally different things. But the problem with mental health is that there's not a provider in a lot of instances to see a patient every week, 2 times a week or something like that. So I think where technology comes in is you can space those visits out so they can see more people. And then technology is kind of like a vehicle to kind of moving forward at home. So that's why I think they need to be done together. What I worry about right now is a lot of technologies developed and then deployed, and there's like nobody to kind of help a person figure out what to do with it, or what it means, or what the person does when the technology tells them something abnormal or tells them something good, because basically it's telling them something like every hour, every minute. And so people are just staring at their watches where they should be out like enjoying the world and finding other things to do outside of data. So I think that's the key, is it just has to be in conjunction with people.
I like, so you kind of sort of made my segue, so thank you, because I wanted to pose to you and Joan the question of what are your thoughts, what are the benefits and limitations of telehealth?
So we are a 100% telehealth platform. And we do that really to enable our ability to scale. And also to meet our particular population that we serve's needs. So we serve healthcare professionals, mainly physicians, nurse practitioners, and physician assistants. We also see nurses and executives, healthcare executives. And I think that time is of the essence here, and that's really a very high value, is what can be efficient. And so if you can have a telehealth appointment from a private office, your home or your car, and you don't need to drive and park and walk to the office, that is incredibly valuable. We can also, what we can do is with psychologists right now, there is an interjurisdictional practice statute that has been passed in 24 states that allows psychologists in those states to be able to serve those other 23 states. So, so we are able to serve a much broader geographic location area with telehealth. Yes, you lose I think we've all experienced what you lose through the pandemic, right? Yes, we have Zoom, we have FaceTime, we have all the ways to connect through video. But that going to Zoom Thanksgiving dinner is very different than sitting down with your family around a table, or talking with your doctor about something very scary is very different than going in and sitting there with your doctor and going through that. So you do lose that connection. However, I think what we have seen through the research from the VA and from the Department of Defense is that there is the efficacy of telehealth is very similar, if not the same, as the efficacy of in-person therapy. And that's why the VA continues to use telehealth as a modality to serve our veterans.
I love it. David, what are your thoughts? I know you're emergency, but
Well, you'd be surprised. So like the emergency department actually has telehealth to outlying hospitals and stuff, where like I'm a pediatric ER doc. If there's a smaller ER that needs help with like a critical ill kid, we can pull up telehealth, and our PICU does that all the time. So I see telehealth being really helpful. I agree. It kind of expands the access and ability to things. And I think kind of how it's really worked during the pandemic is there's just specific experts and trained people that are limited in their capacity to see patients and stuff sometimes. And so one visit with an expert can kind of facilitate ongoing relationships outside of having to come all the way up to OHSU, which is on the top of a hill, and it's not easy to get to, right? So if you see the expert, they can kind of help with medication management, things like that, and then facilitate you back into community resources and things like that that are a lot more available to people. Because I think forever we've just kind of relied on this patient needs to wait 6 months to see a child psychiatrist, where there's just a crazy limited availability of them. Over telehealth, you completely increase the access to that and then facilitate outpatient resources and opportunities they can kind of help a patient to afford. So I think telehealth is really key in that respect. I think there is still a huge thing to seeing people, though. We see a lot of people in the ED over the pandemic who have said, yeah, it's great seeing my therapist and stuff, but it's all via Zoom. You know, it's not as great as seeing people in person. So I think it helps facilitate things. And then there just has to be some kind of continuum of, maybe it's not even a professional, maybe it's, I don't know, a community health person, maybe it's a teacher, maybe it's a school counselor, maybe just somebody that patient can sit down and talk with, right? Outside of a specific provider who just has limited capabilities.
Awesome. Thank you. All right. So I'm going to take us to our provocative question. So the tech industry, in particular social media, but not limited to social media, I think, particularly in the past few years, has taken a lot of hits with regard to its potentially negative impacts to our individual and collective mental health. So how do we reconcile that? And how do we create tools that are to the benefit of our mental health with the credibility that we are benefiting society as a whole? So Rob, I feel like you'd like to kick us off on that question.
Actually, I'd prefer to go last if that's okay.
You always prefer to go last. Joan, what's your thought?
I'm happy to take that one. I've been thinking about this a lot, and I think if social media can focus on the principles of well-being, and if we can go back to, I think Saurabh, started to think about, or started to talk about, what are the things that contribute to one's well-being, and focusing on that versus the competitive nature of much of what social media has become, the likes and the comments and really thinking about moving away from this compare and despair versus really focusing on self-promoting, self-efficacy, self-esteem, if you will, belief in self-compassion, and thinking about caring for each other and build boundary setting versus, again, kind of like away from, are you doing enough? Are you doing enough? Or could there be something better? Could you be doing something better? And I think when you're thinking about building or changing an already existing platform, thinking about not building tech that preys on the cognitive models that we as humans are vulnerable to, and the comparing and the less than, and thinking about like, what's the cost there? We are, as humans, our primal instinct is to move towards safety and connection. And really, social media was very much started around connection. I mean, the original Facebook was about connecting with people at your school, right? It was like I was not an original Facebook user. But it was very different than the Facebook of today. And I think that the idea that we are drawn towards connection, we are drawn towards belonging, and we're drawn towards feeling safe. So what are the things that you can do to kind of emphasize those and de-emphasize what feels threatening or competitive? So that was kind of long-winded, but hopefully it gave Saurabh something to respond to.
Well, we're going to give David a chance next.
I think Joan was spot on. I think so. There's a lot of downsides of social media that I see in the ED, but I think social media could be positive too. I mean, I think it's kind of like what I'm saying with technology is I think connecting people and kind of creating support systems and stuff is key to all of this. I think the downside of social media has been bullying, and it's a lot easier to type something really mean than go talk to somebody, right? Or everybody became an epidemiologist and an infectious disease doctor during COVID and then told everybody what they thought was the right treatment and stuff. So I think that's the downside of social media, is that it just creates this really easy platform for people to say whatever the heck they want without any accountability. So I don't know how to solve social media. I will be the first to say that. But I think utilizing it to create resources and connections was, like you said, kind of what it was created for, and kind of a nice benefit of it. And I think probably focusing on that is a key moving forward. I don't know how that fits into their business plans and stuff, but that's what I would say as a physician.
Thank you. Saurabh?
So I think from a technologist perspective, I think there's two things to keep in mind here. First of all, technology is a tool. I mean, the platform itself, Facebook, technically, or Twitter, is no different than a hammer. Is a hammer a good or a bad thing? It depends on who's using it and what they're using it for, right? See a toddler with a hammer, everybody knows that's not a good idea. See someone on a roof with a hammer, you're not alarmed, right? So I think the first thing I think we need to separate is the technology itself. To Joan's point, the underlying infrastructure or LAMP architecture of Facebook and all other social networks. There's nothing wrong with that. The community of people sharing UGC or user-generated content, right? Actually, Joan, the original Facebook was horrible. It was about judging two people's faces, who is the hotter between them. Zuckerberg started right out the gate with an absolutely egocentric, just screaming for attention algorithm, right? And I think that is what I actually wanted to mention. The business model for social media networks is the problem. It's not the technology. The business model is that you have unregulated advertising, right? They have to keep your attention, and they have to let advertisers target users without any qualifications. So imagine if we had TV ads from drug manufacturers without regulations. We just have ads all day about medicine that none of us, 1% of us need, right? But if they've got the money, they can keep advertising. So I would say that is really the problem right now with social media. At the same time, right, fundamentally, as a leader or a team member within an organization, what can you do from this conversation? Use what you have, start where you are, do what you can. And I think the most important thing is acknowledge, right? Hey, when you start a meeting, or if you're in a meeting and you're with a culture where it's inclusive and you can talk to your peers, if you saw something really upsetting, be willing to bring it up. Build a culture in your organization where people can talk about this. Hey folks, just before I came in, I heard about that tragedy. I'm sorry if any of you know somebody in that country or in that region, right? Or if you're affected by it, and if you want to drop out, that's okay. Acknowledgement is the #1 counter to the ills of social media, is that there are things happening. Let's not imagine like they're not. And if you need time or a way to manage or process that, then we will support you in doing that.
So that almost sounds like that individual responsibility is the solution to social media.
I would say individual responsibility is the solution to any use of media.
Yeah, I like it.
There's nothing wrong with rock music, but if you're using rock music to put your infant to bed, you have some really strange sleep cycles.
That's a great example.
That's the pediatrician. I'm not kidding.
All right, this has been an amazing conversation. So I want to throw one more bonus question. I've peppered you guys with a lot of bonus questions today, so I appreciate your flexibility. Obviously, we have an audience full of professionals who are going to take things back to their workplace and share with their coworkers and maybe even with their families and friends. So on this topic, if you had one very important takeaway that you would want people to consider or to remember, what would it be? And so Rob, I'm going to make you go first.
Sure, this has become personalized here. Okay, so the single takeaway from everything we're discussing, because this is about mental health and technology, is to make sure, as David pointed out, and I think Joan provided some wonderful examples, is that for your organization, your care precedes your technology and certainly precedes your scale. And I'm going to use a very specific example, Reggie. Two of the largest providers in enterprise level, right, mindfulness or therapy, this is Ginger and Headspace, right? Neither could break into a profitable business model. Neither could get funding nor go public. So they merged, right? Why is that? Why are such large startups, unicorns, many times over, why are they having such terrible churn problems? Why aren't people using the mental health benefits that are being thrown at them? Because they don't know what to use. It doesn't start by offering your team a buffet of mental health options. You've now passed the buck. It starts with a simple conversation, right? Of how are you? Where are you at right now? And what can I do to help?
Okay. David, what are your thoughts?
I would say, I think technology offers a lot of really great advantages, and my guess is in the next 5 to 10 years, it's going to explode and make some pretty dramatic improvements in care. But I would just tell people, before your companies start using technology or your family and friends, just understand what the technology is measuring and what you're supposed to do with it. So because your Fitbit told you your stress index is a little bit high, does that really mean anything? Like, understand what it's really telling you. It might just tell you that you moved your wrist around like 5 times in the last hour or something. So I think understanding what it's telling you before you're making dramatic differences or kind of changing your life and your wellness and things, understanding what technology was designed to do, who designed it, and what you're going to do with it.
I like it. Joan?
I have two. I hope that's okay.
That's
But I
great.
have two thoughts on this. One is kind of way conceptual and kind of pie in the sky for, I think, many large organizations. But until we start valuing our workforce as human first and their humanity first, and then I'm not sure that people will truly feel that they are, they belong and that they are safe. So someone needs to be able to say to a colleague or a supervisor, I have this thing going on. Maybe they don't need to share too many details, and I need some help, whether it's time off, whether it's a resource. And I think that, to Rob's point, we need to be training our middle management in particular to be able to have conversations where they know what to do when they say, how are you doing? How are things? How's workload? How's life? And someone brings an actual issue, that they actually know what to do next. Because I think a lot of people are like, so yeah, there's EAP, and do you need a day off? Do you need time? I can give you time. But like, they don't really know what to do with that. So that's actually, that's a skill set and a knowledge deficit that can be solved for. That's one thought. I think the other thought is your benefits and that you offer to your workforce needs to meet their needs, and it needs to be as easy as calling an Uber. Like, we have all these we can get DoorDash, we can get food delivered to our house with just a few clicks. We have a choice of what we eat, and the interface is really easy. Same thing with Uber, same thing with these other services, that we need to be creating services that are streamlined and accessible and actually meet our workforce's needs. Maybe they need a menu of things, but these things right now, you need a counseling appointment through your EAP. You call them, they call you back, they don't have an online interface, then you're on phone tag. I'm sure David can just answer a call in the middle of a patient, seeing a patient. No, I can't either. So then we're like voicemail messages, and then they set me up with someone, and I get these 3 free sessions, and then I see that person and they're not in my insurance network. So now what? And it's just this like, or they don't have openings for 4 to 5 weeks. So there's this issue of we feel like we offer things that are helpful, but is it truly accessible? I think Saurabh's platform, MindCurrent, it is accessible, and for maybe a high proportion of people, that is that's kind of like, we're meeting them where they're at, literally. They're on Slack, they're on Teams. So I think we really need to be thinking about that.
So your response, thank you for your response. And it also sparks maybe a question we've run out the clock with that I would pose to all 3 of you. So leading with humanity is unfortunately an interesting concept, because it shouldn't be, right? But it is an interesting concept. Can we think of, without getting controversial, organizations that have demonstrated that, or even demonstrated it in a single capacity, leading with humanity for their employees?
I think it's a lot around policies and practices. Mm-hmm. And clearly you need to consider your bottom line and your productivity, right? I think we all said that you can't just let people, oh, you're having a hard time, oh, you don't need to work, you don't need to come to work, oh, take as long as you need. That wouldn't work for a large organization if you had a lot of people who needed that. So I think thinking about the little things, like how long, like, for example, David works in a healthcare institution that many of the departments require 90 days, 90 days to request time off. So you can only request time off in 90 days. Now, if you have something that comes up, particularly in this COVID world that we're living in, that policy is insufficient. That doesn't work and that doesn't meet someone's needs. And now they're stressed out about having to ask for an exception to take their kid to an appointment or something else, or like their parent is ill, or and those might fall under FMLA. But I think there's these policies and procedures that need to be thought about and think about, like, what is it that people are needing and how can we be flexible?
I like that. David, Saurabh, any other thoughts on that?
I don't really know any specific companies. I mean, OHSU does a really good job, I think, of trying to give people leeway and really focus on wellness and put people first and stuff. But specific organizations, I'm not totally sure. You know, I think it gets to Joan's point, though. That's the difficulty with all of this, is that it is a workplace, and so you still have to be productive. And how do you do that while also focusing on wellness? Because I think in the past it was all focused on productivity, and so you don't want the pendulum to swing too far the other way, where people feel like they don't need to work. And so you got to find kind of that sweet spot in the middle where you're really focused on people and their wellness, which I think drives productivity most likely.
Interesting.
Yeah. I'm going to take on Joan's lead and provide two things here, because I think that worked out really well. The first, like she did, I think it was a good example, is to talk just for a second about the concept. Why is, to your point, Reggie, why is humanity not first, right? Before we answer organizations that have it, well, why doesn't every org have it first, right? I will say that one thing that we've been working a lot with our customers on, which is very surprising for them, and it shouldn't be, right, is actually moving autonomy to employees. And a very simple example of this for everybody in this meeting, or even in the on-demand recording, do you still have quarterly goals for your employees? If you do, they're already ready to quit. Why? Because it's an incredible amount of stress on employees to be predicting an outcome 3 months out, given the current economic and political climate. Your goals should be monthly. You should be checking in weekly. Now, Reggie, what does this have to do with humanity? This is about prioritizing how your team will perform better. Not what you're getting from them, but what empowers them to perform better. And that's my second point. The example I would use around companies I think that have embraced humanity might surprise you. It's not a tech company at all. Southwest Airlines, right? Southwest is a premium. Their tenure of employees is unheard of. Their long-term profitability, unheard of. They don't even look like an airline on the books. It's so exceptional. And if you've ever had a Southwest flight, you'll notice something that their team member does. They have full autonomy of how they greet you, right? And bring on how the culture of this flight will work. From the very first minute, you know who's in charge, not because of their authority, but because of their humanity. Their employee represents how the flight will run. That's how your teams really will operate at their best, when employees feel empowered to do that.
I love that, Saurabh. I think that is a great way for us to wrap. David, Saurabh, Joan, thank you all for your time and your insights today. To the audience, thank you for listening. I hope you got something valuable out of this conversation, and we'll see you next time. Thanks so much.
Thanks, Reggie.
Thank you, Reggie.